Electronic health records are kind of sitting with one foot in each of two technological eras. The first, the old era, an electronic health record is kind of an electronic place for doctors to write down the chart. You know, this person is sick, save, open it up later. Oh, look, they're sick, right? It's just electronic documentation of what used to be in the chart. In the post-internet, or in the internet era, there's a new role for electronic health records. And there's really four big new things that are going on. There's connecting healthcare providers, doctors, to their patients in the ways that patients actually connect to the rest of the world, mobily, electronically, during the course of their life without beating a path to a doctor's office. There's connecting doctors to payment for results. So when you can actually show that a patient is getting better and not showing up at the hospital, that's a new kind of payment that a doctor can get besides just saying, hey, I saw them for 12 minutes and I want my $200. Connecting doctors to each other, probably the biggest, right? If I've got this picture of a patient and you've seen the same patient, it sure would be neat if I could see what you have and you could see what I have. And then the last piece is connecting doctors to innovation. So doctors' sort of learning curve flattens out a lot after they leave residency and fellowship. It's hard to get new insight into their workflow. And now with mobile apps the way they are, you can take doctors' offices, you know, that used to be sort of locally constructed and make them nationally constructed. All the rheumatologists in the country can be comparing notes through a mobile app for rheumatologists in a way in the internet era of electronic medical records that would have never been possible with paper charts. Doctors really have good reason to hate electronic health records, and you often hear keynote speeches that, oh, doctors are troglodytes and they don't know how to adapt technology, and I'm thinking to myself, wait a minute, you mean the guy who sent a hanger-sized welder up your artery and did surgery through a pin-sized hole, that's the guy who doesn't have a cultural orientation to technology? No, he has a aversion to technology that costs a ton of money to make him go slower at his trade. Like, that's dumb. I think, though, as more and more of the early generations of electronic health records sort of fade into the mist, and these new, more connected networks start to happen, medical records will be a wonderful thing for doctors. They'll actually provide more presence, more ability to stay in the moment with patients, because all the dumb stuff and the reporting stuff and the billing stuff will have been taken care of. And that's what we're shooting for. The role of Athena Health is to try to move society from that first kind of pre-internet EHR, health record world, into that internet-based world. So we're really trying to create a safe enough, secure enough, connected enough to the analog world version of the internet that doctors can actually practice industrial strength, reliable medicine on it.